So, what is the changing trends in general anesthesia? What is happening? Earlier, when there was ether, the sole agent which is used to give general anesthesia, the problem is what happened is a single agent being used for general anesthesia as a volatile agent, that is ether, it has lead to several complications like hemodynamic instability. So, to which the balanced general anesthesia, the trend changed, that is because of the introduction of the synthetic opioids into the field of anesthesia. So, slowly this developed furthermore, and it changed into multimodal general anesthesia, where a number of drugs being used together to achieve the endpoints of general anesthesia. Now, the trend is changing towards the opioid, which revolutionized the field of anesthesia, now is told to be spared from the anesthesia practice. So, what is happening is opioid sparing, and to be more stringent, it has moved even to opioid free anesthesia. So, let us see in this lecture about this opioid free anesthesia, how it happens. So, how to approach whether to practice opioid free anesthesia to analyze the problem. So, there are some problems with opioid usage surely. What is the conceptual strategy based on which the changing trend is being claimed, that is the opioid sparing or the free anesthesia is claimed, and which surgical population is likely to be applicable. So, to which surgical patients we can apply this strategy of opioid free anesthesia, and if at all we are going to practice it, how to make it even more safe, that is the next question. And should we change our practice in India? Is it applicable to the anesthetists who are practicing in India? That will be the next question. So, we will try to find the answer in this lecture. So, what are the possible problems with opioid usage? We know that the opioids have innumerable problems, respiratory depression and the airway related postoperative complications. And the sleep disorder, pharyngeal breathing pattern disturbance is one of the prime reasons which are used for climbing. The close climbs project also shows that whatever the opioid related climbs, it's related to the respiratory depression and the consequent mortality in the patients. And apart from these two respiratory depression, we have two more surgical oriented problems, like the postoperative ileus surely is increased by the is directly related to the dosage of opioids used perioperatively, and also the incidence of urinary retention is remarkably linked to the amount of opioid used intraoperatively. So, apart from this, the three things which are the known problems with the opioid, there are some new problems which are emerging, or we are realizing it as the physiology is getting known, more depth knowledge of physiology is known. So, here we have a opioid induced hyperalgesia is a new term, and we have a opioid induced tolerance, which can be acute or chronic. So, earlier they thought that the opioid induced hyperalgesia is because of the chronic use of opioids. Now, they realize that it's acute intraoperative usage of opioids also can land up in opioid induced hyperalgesia. So, then next is known to everybody, the prevalent use of opioid and the liberal without any regulation is going to land up in a lot of drug addiction among the population. And also they are claiming that the opioid is going to induce immunomodulation and also increase the rate of cancer recurrence. So, these are the possible problems what the opioid usage is having.